What if the most powerful medicine isn't a pill, but a story? Today on In Her Words, I'm joined by Kayla Branstetter, an educator, writer, and advocate for women's voices in healthcare. Her forthcoming book, Don't Be an Athena, challenges the myth that women should power through pain in silence. Kayla's work sits at the intersection of narrative medicine, reproductive justice, and dark humor. Because sometimes laughing through the tears is how we survive. As an English instructor and doctorate of education candidate, she doesn't just study stories, she helps women reclaim theirs. If you've ever been told your pain isn't serious enough, or that your story doesn't matter, this conversation is your invitation to speak, to be heard, and heal. I'm Thando, and today we welcome Kayla. Kayla, thank you for joining us today.
Thank you for having me. I'm so excited.
I'm glad to have you. Kayla, your book is titled Don't Be an Athena, referencing the goddess who sprang fully formed from Zeus's head and silent and strong. What first moved you to challenge that myth, and who did you write this book for?
So the myth came later. Initially, I was going to name my book Choices because I wanted people to understand women's choices that women have made, and humanize women's choices, because I think it's so easy when we're on the outside looking in to be so judgmental about, well, if I were her, I wouldn't make this choice. But you don't know what, sometimes life just gives you two bad decisions and you're trying to make the best of the two worst decisions given to you. And that's what I was getting to, is humanizing women's stories so we can first hit the pause button and understand a person's story before we lead to judgment and decide whether or not we would have made a better choice or not. Because you don't know what choices women were given and at that opportunity. So I also wrote a blog, and I not recently, but at that moment I had finished a book called Off With Her Head. And this book is about how history actually got it wrong on infamous historical women, Cleopatra, and just how we demonized her. She was this powerful woman, and Rome took control over her narrative, and she goes down as this seductress, and even Anne Boleyn, and how these women were depicted because men had controlled their narratives. And I came across Medusa's story by accident, and I wrote a blog, and I titled it Don't Be an Athena. And it depicted Athena differently because Athena has a city named after her in Greece, Athens. She is a highly regarded goddess. And this is a moment where she is quite human, in my opinion. And even though she's this immortal goddess, and in our mind with this infinite power, she still was binded by the patriarchal discourse of the Greek gods. Despite her power, she was still fighting patriarchy. And that came across to Medusa because I played on the Roman interpretation of Medusa from the Roman poet Ovid, in that Athena turned Medusa into this infamous villain that we know of her today after Poseidon had sexually assaulted her in her temple. And how often do we, even in the 21st century, do we continue to demonize and turn women into monsters after something so traumatic had happened to them? We are still doing that today. And that's why I thought it was still such a powerful parallel, whether we're talking about reproductive health or sexual assault. And sometimes it's we as women are just as guilty of turning other women into monsters after they had undergone something so tragic.
That was so true. And it's so crazy that till this day, women are so demonized for things that have been done to them and
yes,
lashing out. You've said your work centers on women's stories being treated with the seriousness they deserve. For a young woman who may be navigating the healthcare system not built for her, what does being taken seriously actually look like? And how can storytelling help that?
I think so often you hear, I don't think I've encountered a woman who has seen a doctor and said, I don't feel heard. And when medicine was institutionalized, guess who was left out of that institution? We as women. So, literally, for centuries, men have been in charge of studying the human body, but they've only studied the man's body. And biologically, obviously, women are just so different. And I think it's difficult for when a woman is talking about if she has endometriosis and she has so much pain affiliated with her monthly cycle, can a man truly understand what that's like? No, they can't. Do they understand? I remember after I had my second daughter, I asked for, I think, naproxen, which is just prescription strength ibuprofen. It really isn't even a painkiller. And he told me, no, I was fine. And it's like, I just gave birth and my pain was completely diminished. My best friend was in the room and I thought she was going to physically assault the doctor. She's like, what? And storytelling can help because if we think about we as humans across the world, every culture, every ethnicity, every religion, from the beginning of time, what has connected us as humans? The power of stories. Stories remind us we're human and it allows us to connect. We can come from two completely different countries and two completely different backgrounds, but when we start talking, we start connecting, we start finding the similarities versus our differences. And narrative medicine trains healthcare providers into understanding the power of the story, because when you go to a doctor and they look at your chart is telling a specific evidence-based story, but they don't understand the story behind those numbers. And I think as a woman, it's reclaiming our voice, that you have a voice when you go see the doctor, and that story is far more powerful than whatever your medical chart is saying.
And I don't think we've ever thought about it that way. Usually doctors are so, oh, if you're experiencing this, it should be this. And like you said, your doctor dismissed you because they thought, first, he's never given birth. He does not know how he feels, how it feels. So that is just a very interesting way to look at medicine. And maybe that should be the future of medicine, just storytelling behind a patient is a person with these backgrounds and stories. So I'm grateful for you taking that charge and leading it.
Yes. Narrative medicine found me. I found it when I wasn't even searching for it. I didn't even know my book would be in the medical humanities. And now I'm working on my doctorate in the medical humanities. And when I tell people I'm getting my doctorate in education with an emphasis in healthcare, where I have an advanced degree in the humanities, focusing more on creative nonfiction, people are like, hold up, how does somebody who teaches English and higher education end up in healthcare? And I feel like it makes sense because medicine is an art and a science. And we focus so much on the science part, and we need to. I'm not trying to downgrade the importance of taking chemistry and anatomy and physiology and biology and taking these courses to understand how the human body works physically. I'm saying that these same people need to be in the humanities and find out how the human body works emotionally and spiritually and the storytelling component of it. And I'm working on the art side of medicine to treat women and patients altogether, mind, body, and soul, and have more of a holistic view on healthcare.
So that's so amazing. Many women have been told to power through with pain, without complaint. You call this the myth of silent endurance. What is medical gaslighting, and how does it show up in different forms for women across races and geographics?
I think, like I said, your pain is diminished. And like I had just given birth and my pain was diminished. It was like this medical gaslighting of I'm trying to verbalize that I'm in some kind of pain. And it's more like, no, you're not. You can take a Tylenol and you will be fine. Just push through it. And I kind of didn't feel human. It was more of like I did my job. I had a baby. We're concerned about the baby, but we're not concerned about your health now. And that's problematic because we need to be taking better care of our mothers, period, even after birth. And in the United States, some of the statistics coming out of the United States is not looking too promising at all. It was safer for my grandmother to give birth in the 1950s than it is today. The maternal and infant mortality rate is on the rise. And in the state of Missouri specifically, 42% of the state, they don't even have labor and delivery units. And so that's just going to further complicate the issue, especially among rural women. Rural women are going to be delaying their prenatal care, so we're not going to be able to capture preeclampsia and HELLP syndrome and, gestational diabetes quick enough. That's definitely going to compromise labor and delivery in their postnatal care. And even if you look in, I think I read this statistic about Black women in the United States. We need to be having this conversation because Black women, I think, make up, I may get the statistics wrong and I'll have to fact check, but it's close. I think they make up maybe 10% of the American population. But they're making up, I think, almost 40% of the maternal mortality death rate. That's alarming. And part of it is their voices are being dismissed. Black women are more likely to be pressured into having a C-section over white women. And then after that, kind of like what I experienced, their pain is diminished. Their symptoms are diminished. And then later on, a lot of these women are dying postpartum, not necessarily during, because their symptoms after birth are being denied. And I think with storytelling and with narrative medicine, and if they were to take a literature course focusing on literature and seeing from a Black woman's perspective and learn to gain trust with that patient and understand and actually listen to her concerns, can we make some headway in addressing this? In my opinion, it's an epidemic and we have to address it.
I just released a podcast episode 3 weeks ago with a Black woman who's a nurse in the US, and she speaks on behalf of the medical the healthcare system in the US and how Black women aren't being heard. So that is so true.
No, they're not being heard, and I think it goes back to the birth of this country and how we viewed Black women and how that stigma of how we continue to view Black women has yet to leave modern medicine. And it's far time that we have to separate the two and view women as human beings with stories and all these complexities and truly understand their concern.
You touched on, rural women and their experiences. You teach first generation and rural students, women who navigate systems with limited resources, as you said, in the state of Missouri. What's one lesson from your classroom that you wish every healthcare provider knew?
Don't assume a person's story. Being in a rural area, I think we have a lot of individuals. They are laced with, my grandparents, this is how they treated a cold. Do this, and they automatically mistrust the medical community in rural areas. And I think their concerns are valid at the same time, because I think we see them and I like to challenge against this because I'm in a rural area. I'm not uneducated. I have a doctorate. I work across the world advocating. So if you're going to assume that I'm from a rural area, that I'm automatically an uneducated individual who will listen to generations of how my family took care of colds, then I think you're missing the mark. At the same time, you're making a generalization about a population that could be completely fictitious, and you're dismissing people's concerns when they do go to you. And I think that's part of the problem with rural communities not trusting the healthcare community is I think they have this predetermined narrative before they even step foot into the exam room, and that's problematic. I don't know. I've seen some heartbreaking concerns even in my classroom. A couple of years ago, I had a young student. She was probably 20, 21. She was pregnant. And over the summer, I found out a local hospital was shutting down, and that's where she was going to deliver. And I told her, I said, "Hun, what are you going to do?" And she goes, "Good question." She goes, "They didn't even bother to call me to let me know that they were even shutting down." And so her commute had gone from 20 minutes to an hour and 15 minutes. And this is July. She's due in August, and trying to find an OBGYN who is going to deliver her baby in such a short time frame. And like, we're working, trying to figure out, like, can we get gas cards? How can we support this young woman who is getting ready to become a mother? But there are ways. I think community engagement, I think public health literacy helps, but we can't just diminish these people in rural areas, their stories and their concerns. Even though they may be outlandish, you still need to listen to them.
In markets where formal reproductive health is still emerging, especially like in Africa for us, what principles from your work can women adapt? For example, how can community storytelling, digital tools, or peer-to-peer supports change the narrative of medicine?
I think this generation of women, I think our generation of women, I think we're taking control. I don't remember my mom having a conversation with me about my period. I had that conversation at school, and I just remember being panicked. And there was it was like shrouded in secrecy. It's dirty. You hide the fact that this is what you do as a woman. And I had this conversation with my oldest daughter when she was 8 years old. At 8, we were talking about her body. We were talking about what her body's getting ready to do. Now that she's 11, she'll come in, and her friends, they're having open dialogue about periods. They're not trying to hide their menstrual products anymore. And it's like we're making it to where, don't be ashamed of the fact that this is what your body is doing. And from my book, culturally, there was one woman I had interviewed. She had such heavy periods as a teenager, but if she had visited the gynecologist as a teenager, there was this assumption she was sexually active. And if she's sexually active, then that would bring dishonor to her family and to her culture. And in her culture, bringing honor to your family is just the cornerstone of it. So she felt like she couldn't go to her parents or go to the doctor because she didn't want this impression that she was sexually active before marriage. But she had endometriosis, and then when she was in her 30s, when she was married and did want to have a baby, the doctor said she had to have a complete hysterectomy because of the damage that endometriosis and fibroids had done. So I feel like when you hear these stories, and if fertility is so important to your daughters, having that open conversation, and even as a community having these conversations of, if your periods are painful and you're bleeding a lot, that's not normal, and you do need to go to the doctor. And my daughter, I just had that open conversation with my daughter. She'll ask me, "Mom, is my period going to hurt?" And I said, well, there's going to be some discomfort. There's going to be symptoms that we don't like, but it shouldn't be life altering. And if it is life altering, you need to tell me, because we need to go to the doctor and figure out what is going on, because I want to protect my daughter's fertility. If they don't want to have kids, I want that to be their decision and not something that was decided for them.
Thank you for sharing that. That is true. Like, we are becoming more open and learning more about our bodies. Even on social media, it's so prevalent now to us. Your book
Yes.
uses dark humor alongside deep pain. How do you decide when humor helps and when it might harm? I'm
When
South,
humor helps.
I'm South African, so we make a joke instantly about it. Now, history is dark.
uh, my next book is actually written in humor. And actually writing in humor, I think, is far harder than writing these poignant stories of women, just because you have to maintain that tone for so long. But I try to find humor in a lot of things, just because how do you process without being like, so, I mean, I will bring this up because my grandmother last week, so my grandmother a couple weeks ago broke her hip. She's 87, and she is the world's worst patient. Very demanding, will let her opinion be known. She has no problem holding back and telling the doctors and the nurses her thoughts. Well, my grandmother suddenly passed away on Wednesday. We weren't expecting it. We think she had a blood clot. And she was 87. She lived a great life. And she died relatively quick and painless, which is, that could be what we all would wish for. But then a part of me, we were trying to find the humor in it of like, well, she was herself until the end. Like, my grandmother was just this very vocal woman, and she maintained that to the end. And I think we're trying to hold on to the humor of the situation, because if not, how can we move forward? We'll just continue to fixate on this little thing of like, well, what if we did this? What if this happened? Why didn't they do this? And we can just focus on like, grandma maintained her sassy attitude until the very end. And we're trying to find the humor in it all.
My condolences about your granny. And I'm so glad that you're finding the humor in it to heal yourselves as your book is telling these, deep stories of these women and finding a glimmer of hope in it. I think it's such a wonderful way to honor women and these women and their stories and other women who have possibly going through it. And I can't wait to finish.
I want women, and even though I'm hoping the book sells internationally and I focus on American women, but there were some women who are like first generation Americans, so there are some cultural differences as well. I want women to see themselves in my book. I want them to resonate, and I want women to understand we are more connected than not. And so a lot of these women come from different races and socioeconomic backgrounds, education backgrounds, religious backgrounds. And if you finish the book, I hope you walk away realizing, despite the diversity of these women, there's a linear theme throughout it all.
And we're all just women.
We're all just women. We're all just trying to survive. We have similar experiences. And even if it's something you didn't experience, I'm hoping it humanizes you to realize that may not have been a decision you made, but at least understand why this woman made a decision. And I had a friend that recently finished my book, and she said, and essentially I'll paraphrase, it humbled her a little bit, because she was developing narratives of women making choices. And that narrative was challenged when she actually got to the story of why women were making certain decisions.
That's very powerful. And that should be what we take out of something like your book, instead of judging each other for certain choices and narratives.
Yes.
What is one question you wish more people, how is, this is not the question I want to ask. How can educators and advocates or friends or supporters or support someone navigating reproductive trauma without overstepping?
I feel I've been through this with infertility. I had a miscarriage, and nothing exposes you to the dark side of humanity of when you're going through a specific type of trauma. And I think we often try to make a statement out of goodwill, out of good intention, and it just comes across
Crazy.
yeah, not that way. And I remember, I don't know, when I was going through for infertility with my first daughter, it just felt like my womb was like open conversation. Like people just felt like they were entitled to give me advice, and I wasn't getting pregnant, and my age was starting to become a factor. and and that taught me, because anytime someone got married, and now when I approach young women, I never talk about the reproductive unless she talks to me first. So if you have a recently married couple, I never ask, like, so when are you having kids? I refrain from that question, because I was asked that question, and it's so, I don't know, it's like violating. It's almost like, hey, I've been married for like 30 seconds. Can I at least enjoy this being married? So it challenged me. But even after my miscarriage, people would make statements, and it's so outlandish, like you said. And I had my miscarriage, and people were like, well, what was it? Maybe something was wrong with it. And another one was, because I love coffee. They're like, well, maybe if you didn't drink so much coffee, you wouldn't have lost the baby. And it's like, I had already switched to decaf. And like, they didn't even know. And it's like, if you can't say anything nice, just don't say anything at all. And sometimes in these situations, we don't even understand our grief. We don't even understand our emotions. And in my TED Talk, I talk about that sometimes if all a person needs in their moment of grief is a shoulder to cry on, then that's all they need. Sometimes that's all they need. And remaining silent and just letting a person cry and grieve is all they need, because getting them to talk about their emotions at times when they don't understand their emotions is just as toxic, I feel like.
It really is. It's so insensitive.
Yes.
I always say, when my friends are venting, I'm like, do you want me to add, or are you just venting? So I know, because a lot of people go into, let me try to fix it.
Yes.
Shut up and listen. What is it that you need? And I think we need to be more compassionate to people who go through such traumas.
Yeah, sometimes people just need to talk, and they may not make sense. And if they are communicating like, listen, I just need you to sit quiet. I want to talk. I don't need advice right now. I just need to get my emotions out. And like you said, I think we just need to be compassionate and respect that boundary of, they're not looking for advice. They're looking for a moment to decompress.
My one last question is, if a listener takes away one small, brave step to honor these stories or support other women this week, what would you invite them to do? I think we just spoke about that right now.
My number one goal, well, I have a handful of goals. If I want women, I don't know, I feel like my book, there are like three main takeaways. We can look at it at the humanistic level of just these women as singular women, as their own stories, and learn to connect with them and understanding the power of storytelling. But I think it's also a broader, if we take a step back and look at the book, we can look at the systemic racism, and we can look at the poverty, and we can look at the geographic. So it's individualized, but it's also a systematic problem of how would these women's stories be different if we actually address these social net issues. And that's what I hope to take away of, like, one, learn how to have compassion and learn how to understand women's stories before you judge. But at the same time, how can we as an individual be a source of change to where these stories don't happen again?
And Kayla, where can our listeners or watchers find you online or anywhere?
You can find me on Facebook and Instagram. My Facebook, you will need to do a friend request. I got overwhelmed with trying to manage all the social media accounts, plus a full-time job, plus doctoral work and my children. But Instagram, LinkedIn, I do have a website. And soon the links to my books will be on the website, but you can pre-order on Barnes & Noble. Ozark Hollow Press is my publisher. You can direct order through there. And on Amazon, it will be an ebook direct to the Kindle.
And I will link all your social media pages and your website.
Oh, thank you.
So,
okay. All right. Thank you.
Thank you so much for joining us today. It's been such an insightful conversation, and I'm really excited to finish the rest of your book, and I hope people get it. And thank you so much.
Thank you so much. Thank you for having me.